17. You'll do it once. Okay. So you leave it out when you're doing the crown and distal points. Okay.
If you see this tongue is like mostly like coated with the liver and the spleen, but if you see the maximum darkness on the lungs. So on the right side. See?
No.
One is the
It's
God,
clustered.
one is not. Same thing with
Vata Pitta problem.
Pitta always dominate me.
Anu, you wear the coat. That will work, right? If you wear the coat.
So, if there is like black spots on your lungs area, you will not find many symptoms. Okay, there will be 1-2 common symptoms, which will be one. In the cases that will become chronic bronchitis issues, ITs. What is that?
Bronchitis.
ITs.
Inflammation.
Pitta.
Inflammation.
Okay, so inflammations. There is inflammations in the alveolis. Okay.
Alveoli.
Yeah. Second, there will be excess heat inside the you can say like किसके पास अलग चीजें
Bronchitis.
Okay. In the skin, excess heat in the skin. जाके पूछो.
Sorry, Nemi, can you say again? Bronchitis.
Excess heat in the skin. Okay.
In the skin.
Heat?
Skin. Okay. Bronchitis. After this, there is the people having the issues with the smell.
Smell.
Yeah,
Lungs?
yeah. The condition that
That
people
is,
have in mind.
smell is not working. Sense of smell not
Two things will happen. One, smell is not working, or second, there is always dirt type smell in the smell.
One.
working.
They can smell
Like
one
dust
thing.
or dirt.
Yeah.
What? Sorry.
Their own smell is some like
Smelly.
smelly.
Bad smell.
Very.
They have a
Body-
bad
body smell
odor.
is bad.
No. In the nose, they
In the nose they have bad smell. Okay.
Oh,
Like-
they smell.
Yes.
Everything like smells bad to them. Like this what they smell
Everything
in the
smell
nose.
bad.
Yes. Like
Others they have little bit of bad smell. Okay, not in all case. The maximum the symptom what you will find little bit of the bronchitis issues. The second one is like this one's the
Hot and cold and sickle.
skin issues. Third one is mild temperature issues. Okay.
No
And-
congestion.
Hmm?
No congestion in the.
No. Let's create more congestion. So this is the pitta. Okay. Vata and kapha will create more congestions. Okay. And the fourth one, If the case becomes a little bit chronic, that will create a little bit TB related issues, tuberculosis, right?
TB.
Case is small. But on the like lungs, on the lungs, black tongue, there is not many symptoms because the function of the lungs is very, very small to exchange gas and this. So maximum, maximum issues. This will happen more in your heart and liver. These two will give you more problems because heart will circulate acids, liver will produce the acids, and third one will come. Then which lung will be affected?
The left.
The left lung will be little bit more affected in these conditions. Okay. So in these conditions, I have not seen similar many cases. Which is that in each and every case, the similar case which many, I have not seen many cases like this. And there's very few cases on the black tongue on the lungs. Mostly that's on the liver and the spleen and heart. These three are the more important.
Liver, spleen, and heart.
Okay? The protocol is very simple protocol. Just write in the point. Arrange something, LU1 bilateral, LU10. Yeah, LU1 is here, LU10 is here. Again on the palm because of pitta point, no? So between this bone and this bone. Okay? Khushi Jyoti, you can search on Google. Okay? This is the wrist. This is the first joint. Between these two, on two part of your hand here. Okay? When you have the little bit of the like sinus issues or temperature fever issues, no? When you press this one, no? This will be a little bit more painful and become more tense.
So this is the LU10. This is LU10.
Yeah. Here. Okay. See, this is the first joint and the wrist. Between exactly between these two, on the medial side here. Again, I am going to repeat. This is the first joint. See, from the first joint to wrist joint. This is half of this joint here. When we do like this will come on the top of this more here.
White part, black part, ಅದು
Yeah, that's the good question. Border of the white and black part. Okay? On the border of white and black part.
The border, so closer to the edge, I was putting it inside. So this one is
We don't have white and black.
so it's right at the edge of the wall.
Yeah, right the edge
It's a
of the
fleshy part, but very fleshy.
Okay?
this color change.
This point is very good point for your heart fever also.
Heart fever.
Hot fever. There is two fever, no? Cold fever, hot fever. This is only cold fever, right? And you turn on the fan.
Not a fever, but cold ಆಗ್ತದೆ. Yeah.
So this is going to be left in or
With more congestion on the tongue is more right side than right, more left side than left. If you use bilateral, that's all because we have two lungs, left and right.
LU1.
You use bilateral. Okay? So later you can do a little bit more research when you find some black disease in tongue on the lungs. Both the patients are complaining, write all symptoms and try to find out for 5 more patients which symptoms are the more common symptoms. That is a nice problem. Okay? So some cases like not very common, no? To do research on that is very difficult because I have one case history of like lungs, black tongue on the lungs. Now I'm waiting for the next one. If not coming, then we can't explain through the only one tongue, at least 10, 8 tongues minimum. Then we can compare the symptoms. Then we can do research on these, why these symptoms are the more common. Okay? Use the some physiology, then use some pulse diagnosis, then you believe about that.
Then L1, L1
L1, yeah.
again.
L1 from the sternum, this is the sternum, from the sternum to 6th tune, 3 finger, 6th tune toward of the shoulder. Okay? Go with the clavicle bone. And where the 6th tune is ending, from the bone to 1 tune down. From the bone to 1 tune down. For example, this is the sternum, okay? We count 3 tune, 6 tune. Okay? Now here is 6 tune. 1 tune below the clavicle bone here. Okay, so 6 tune from the sternum, center of the sternum, and 1 tune from clavicle bone, the collar bone. Okay, that is
Not
your.
very deep again.
Huh?
Not deep.
Yeah, when you do this now, you will feel one wrinkle, deltoid wrinkle. Okay, just next to deltoid wrinkle there. This is a little bit sensitive point. Always when you do this now, this one is always little sensitive point. Half tune needle. All the needle on your chest always go half tune needle. 25 size, half tune needle.
And we don't, that's not bilateral, no?
Hmm?
Bilateral, no?
You just use the
Yeah.
You can
Just
use bilateral.
Okay.
You can use bilateral.
But where the more affected side,
Yeah, you can use the one side also, which is more effective. You can use only that side only. On the liver. On the liver you will find many tongues.
Many.
Tongue.
Tongue on the liver. Mostly on the liver and like the spleen together you will find more together protocol. So both are producer okay, no?
Yeah.
Can you see this one?
Yeah.
एक बात सुनो,
Yeah.
ये जो ये है ना,
now you're in
इसमें लीवर उस तरफ नहीं आएगा, क्योंकि सर इधर है, राइट साइड में लीवर आएगा।
मैं भी सामने खड़ा हूँ आपके। मैं ऐसे खड़ा हूँ, ये जो मेरी टंग है ना,
हाँ
ये मेरी टंग है, मैं ऐसे खड़ा हूँ।
अच्छा।
लीवर की साइड में आएगा।
लीवर आपके वो आपका टंग का राइट में आएगा, क्योंकि सर आपका नीचे है ना, टंग का टिप जो है ना, वो सर है ना।
नहीं, टंग नीचे है ना, उल्टा रखना गया।
बहुत
ये ऐसे।
हाँ।
ये exactly thing
यही
this
टंग
is
है।
my tongue।
तो ये लेफ्ट, ये राइट हो गया।
जो मेरे राइट साइड में है वो मेरे टंग के राइट साइड में है, जो मेरे लेफ्ट साइड में है वो टंग के लेफ्ट साइड में। वो चाइनीज पीसीएम में वैसा है, पीसीएम में लीवर लेफ्ट है और स्प्लीन राइट है।
Oh, is that so?
Pulse also।
But they must have opened the body and seen where the spleen and the liver are.
You go and fight. I don't want to fight with Chinese people.
ಅಲ್ಲಿಂದ ತೋರಿಸಿದ್ರೆ ಸಾಕು ಎಲ್ಲರಿಗೂ ಬರ್ತದೆ.
Okay. Next time I'll observe you.
ಅಲ್ಲಿಂದ ಎಲ್ಲರಿಗೂ ಬರ್ತದೆ.
Like this.
ನೋ ಹಾಂ ಅದು ಕೂಡ ಓಕೆ, ಬಟ್ ಹಾಂ ಅದೆಲ್ಲರಿಗೂ ಗೊತ್ತಾಗುತ್ತೆ.
But he can't see. Maybe you can't see.
ಎಲ್ಲರೂ ಸಿ.
Sorry, what were you saying, Jyoti?
The guy.
You can't see the screen as in what screen?
Oh, the
Okay. Must be some internet issue.
So liver is the protections of the black biles, yellow biles. So of course there will be long line. So I can take chair and sit and we'll discuss one by one everything. Okay. No, it was not more important topics. So you don't need to know that.
Oh.
I said like liver is protections of the black and yellow biles. So of course, if there is a black spots on the liver, then there will be many symptoms.
Yes,
Understand? If there is a black tongue on the liver, what will be first symptoms?
Swelling in food.
Yeah, mood swing. Mood swings.
Wow. I don't know.
Anger.
Say again.
Okay. What is the next? Yeah, menstrual cycle issues. You can write that. What is next? Gastric and bloating issues.
Bloating.
Gas and bloating issues. Now see, the bloating and gastric is very common with many tongues.
Yeah, that's what I think.
Okay? So, because bloating is just symptom.
Mm.
Bloating and gastric is just
Symptoms.
symptom. The root cause is very different. So, what is the root cause of the bloating and the symptoms? That we will identify through the
Tongue.
tongue. So, as per the tongue diagnosis, we use the protocol. Not as per symptom. If patient say I have bloating, so we will not use any protocol for the bloating. What is the root cause of that? Then we see the tongue. What tongue is giving the, if there is like black tongue on the liver, then we use the bloating for the liver protocol. Understand? Okay, what was?
All kind of digestion
Jaundice.
issues. All digestion issues.
Okay, digestion issues. What more symptoms?
Okay. There should be circulatory issues because it is sending the black bile to heart and to circulation.
Arthritis issues in future, because liver is produced collagen. In the liver, if there is excess amount of the black biles, then black biles will circulate with your collagens too. So all the people in the joint with the collagen, there is lots of the biles with the joints. So the people having the more rheumatoid arthritis issues in the future. We already discussed rheumatoid arthritis when there is the black tongue. Okay, that was like all over the acid is moved all over the point of the body. Okay, when the liver, then that also will expand slowly, big joint, then smaller, then it will go like this. Okay, mostly liver related arthritis start from the foot, from the hair, and from the knees, then slowly coming to big tumors.
There's something like when someone drinks a lot, the liver gets
Fatty
fat,
liver.
and they get swollen
Cirrhosis.
teeth. That would help happen with the problem in the liver.
That is the cause.
See,
I mean, like exercise.
that's the heavy feed. You are talking about the edema, right?
Yes, he's talking about edema. That's very
Yeah.
So this is the happens with two things. There is two type of the edema. Okay, one is water based edema, and second one is the vata based edema. Okay, it's a wind based edema. So there is two type of edema. One edema, when you press the skin, you can see your thumbprint on that.
won't come back.
Won't come back.
That's vata.
Okay, that is kapha based edema because of the full fluid, no?
Oh.
Okay, that is connected with your kidneys.
And what-
Urinary water retentions from your kidney. Okay, one is vata based edema, fully swollen, and when you press, you will leave, so it will come back. Okay, but sometimes if you see some people, whole body is normal, but only stomach become like this. Edema in stomach, all body is normal, but only stomach become like this. Okay, that is wind-based edema. That is the cause of the liver and gallbladder. Wind-based edema.
Wind.
Yeah, wind, gas, vata. Okay?
Wind-based edema.
Yeah, that is cause of the gas, and that the pressed, that kapha base means there is more fluids, and in this condition, wind means there is more gases.
I thought it was always fluid.
No. दो टाइप के एडिमा होते हैं, एक में जब तुम प्रेस करोगे तो खड्डा पड़ जाएगा, ठीक है ना, वो किडनी की वजह से यूरिनरी ब्लडर की वजह से होता है। दूसरे के अंदर केवल लेग स्वलन होता है लेकिन उसमें जो है फ्लूइड नहीं होता है, तो वो जो होता है वो आपके लीवर एंड गॉल ब्लैडर की वजह से होता है।
Again?
I already explained you.
So that will be the last case will be more Vata.
Yeah.
Vata
Vata is
gases.
like Fuki body, like little bit of the swelling, you will see like this, okay, but there is not that much of the fluid congested. Okay, for example, okay, good example. There is one Marwadi auntie and uncle coming for the knee treatment, if you know, 7 o'clock.
Yeah, the Sardarji and his
No, the Marwadi eye
Marwadi.
treatment for the knee and so on.
Yeah, the lady is having.
That edema is wind-based edema.
Yeah.
That edema is wind-based edema. If you see, leg is swollen, okay, but there is nothing. There is just gas when you are inserting the needle, and when you are pressing, so that you will feel just pain, nothing else. Okay, and that person we were talking about that
Yes.
Badwa.
Badwa.
He was angry, don't touch my needle. That person, no, he's coming with
Dog
care.
ran with stick.
With
All
his stick,
right.
you used to walk with it. People used to walk like this. No, his edema was the water-based edema.
Okay.
Okay, when the next time patient will come, I'll show you that practical case. So there is two type of different edema. So in kapha-based edema, when you will insert the needle, when you will take out, water will come out from there. What will come out? The fluid will come out.
If it's tougher.
And the air, the Vata one, is related to the liver.
वो पूरी बॉडी में नहीं था, वो केवल एक जगह पे वाटर कंजेस्टेड था, लोअर बैक में.
So what did we say? Water based is
The water.
and air based. One is gallbladder and one is liver.
Yeah, so water-based edema related to your urinary bladder and kidney. Urinary bladder and kidney, and wind-based edema connected with your gallbladder and liver.
But that can be emotional as well. Because I had a person before and they had edema, and like it was the water-based one, and water is emotion. So I said, when you got this, was there something that happened in your life? And she said her husband died, and like it was stagnation of the water, like of the emotions.
Okay. Anger issues, suppressed anger mostly. Lots of suppressed anger.
So we.
Okay.
Second irritation will be there.
Irritation is nothing, right? Irritation is just mild symptom of the same like mood swing and anger. Okay. The third one will be migraine.
Migraine also so many times.
So many times. Now you know migraine is not only one root cause. Okay, migraine, there is different point for migraine and different root cause for migraine. Why the liver? When the liver is like not balancing excess of blood. We already discussed the grey matter is controlled by pitta.
Pitta,
And productions of the pitta is comes from
the liver,
liver. Okay, and the second white matter is controlled by
kapha.
kapha, and kapha is production is happen through the spleen. So in the spleen, what happen? Due to spleen, when we come on the spleen and kapha, due to spleen there is more high chances of the stroke, congestion. Okay, due to the liver there is the high chances of the inflammation. When there is a stroke, now when the doctor do the scanning on the brain, they will check there is a inflammations in your brain.
Because
Okay. Stroke is different. The stroke is something is congested, and inflammation is something is
Inflamed.
inflamed. Okay, so due to this, there is more inflammations in the gray matter. Okay, all artery become hyperactive. In this condition, in this case, if you touch that temporal artery, no, or sometimes you don't need to touch from the external, you will see the arteries moving like this.
Yeah, there was a woman yesterday and she had.
I remember that. Okay, because black bile is directly entering in your artery systems, so of course it will make more sensitive your all the artery systems. Okay, so especially when you touch here in Ayurveda, when we check the nadi krisa, there are 6 to 7 different parts of the body where we check the nadi. Okay, so there is one temporal artery, when there is one, which are you? Carotid artery. The third one is your radial artery. Then we check something here, all the different arteries. Okay, but why this is important? We will start nadi pressure that time we will discuss. Okay, so this is the artery is more like pumping like this. You see from the external, some patients the artery is like doing always like this. You don't need to touch. Yeah, so you can feel that from the. Yeah. Okay. Sometimes when you touch here, if you feel the artery is moving.
So it'll be a pitta headache or migraine.
Okay, migraine we have very good treatment, very good results for migraine, very good results. Okay, and will come with this will come with the migraine. Okay, the second it was high mental tension. High mental tensions. They have very high mental tension. Like how we have the physical tension, no? We want to do like this. Oh, we feel the relief like when they are doing like this, no? Body fluid became the tense. They are not relaxed properly. Exactly same they have that type of the mental tensions. High mental tension. Okay. This cause in future can create 2-3 big issues. If there is a like the same what we have all over the body, pitta imbalance, no? Exactly only liver pitta imbalance can create the problem. That is blood cancer. In future, that can create the blood cancer. Okay. Very high chances of the paralysis because of the gray matter inflammations. Okay. Rheumatoid arthritis we already discussed.
Is paralysis always grey matter inflammation?
No, there's sometimes white matter stagnations also can create a paralysis.
Okay, we just know nothing about it.
Inflammations, brain paralysis, recover fast. Stagnations one recover slow. Okay, this all what we discussed now, this all are very common symptoms. These all are very common symptoms. Understand? The protocol, best protocol for this.
The liver,
Yeah.
liver 2 and 3. How many liver points are there?
3 is good. I can agree with 3. 3 is very good to circulate anything from the liver.
The Bell's palsy, when the people have the.
Oh,
So is that also similar?
the facial paralysis.
It's a kind of stroke,
Mostly what I saw, the Bell palsy is mostly connected with emotional, but what was the specific emotions I have not figured out. Whenever I had like 2-3 patients still for Bell palsy, when I checked, they have like little problems, but in yellow tongue, I feel the more Bell palsy. I saw that all the Bell palsy patients were having more with yellow tongue.
That
What-
comes
what
from
patient?
stroke, doesn't it?
Cerebral
The Bell
palsy.
palsy comes
Bell
after
palsy is
the
like only
stroke.
facing
That's
paralysis.
before my brother.
He was born with it.
No, my
He
brother
just
had
got
it.
it. He woke up and had it.
Yeah, one day.
No, Bell pulse is like your pathological or emotional issues after this happened, not before. It's
I
suddenly
thought
like-
it came after a stroke.
It's like night you're sleeping, when morning wake up, like this. Stress is one of the causes I can see there.
Yeah,
Okay,
acupuncture
message-
could be very good for that, no?
Yeah, acupuncture help a lot for this. A very good result for with acupuncture. Krishma had no babka on her Krishma.
कौन था?
Babka पता है?
हाँ बाप का, वो बाप का जो ना.
Krishma.
Yeah.
She had bell pulse, no before.
Fall, man.
Huh?
Fall, my brother fall.
Follow her?
Yeah, he went to acupuncture.
Somebody else had recently got
Hello.
Where I see that?
How
Ah,
would you?
I know.
You would stick needles on the
We
other
will
side?
discuss about that. We have some protocol for that. One day we have time, that day we discuss with small all the issues, like how we discuss tonsils, the bell palsy, ear problems, eye issues directly. You can target it away. This is the fixed protocol. This is the like
Okay,
root
okay.
cause on pathologically, that is like very common. Okay. Very good diagnosis for treatment for this is diamine.
Yeah, man.
Oh.
Yeah. So if you remember, I already told you before. In which condition we use the diamine?
Digestive issues.
Liver.
As per tongue, I already told you before.
Oh right, yeah, you did. When it's a black tongue, you use tiamine.
Okay.
He
He said
said
the tongue is
before,
black,
like you know, when it was
black.
all black, he
You
said
know,
to use.
we had a patient some time back. We had a completely black tongue. He was like a South Indian guy coming here. Did you
It
fix
was
it?
Karthik.
Huh?
Karthik.
Oh, Karthik. The Tamil people Karthik.
Okay. So we use the diamine. After the diamine, if you want, you can use this small protocol. Put the needle on the liver 3 and give deep moxa.
Liver 3 and
So you would put it on two places
No,
on the foot.
not with the diamine. After the diamine.
Oh, after the timer.
so liver 3, just liver 3
Yeah.
with moksha.
Only
No, only liver 3. पहले diamine, then after that separately liver 3 with moksha. Okay.
Where is the liver tree?
Sometimes it's stiff for people.
That means you have a
I
stiff
think it
liver.
goes 1, 2, 3. So it's not like this is a pitta tongue, so we don't, and pitta can be excess heat, so we don't apply moksha. It doesn't work that way.
liver 3 will apply. Liver 3 will give the moksha. Liver 3 will give the moksha.
Yeah,
For diamine, will not give the moksha.
yeah. But you know when there's bloating as well and there's excess gas in the body, and say you're doing daimai or something for it, yeah? You wouldn't do moksha, would you?
No, on that will not give moksha. Mostly on diamine, we never suggest to go with moksha.
Okay.
Diamine with
But
only
when-
electro or just use the needle.
But why do we use electrodes? So when there's, would we
Electrodes help a lot. For example, kapha. If you give the moksha, the electro on the kapha, no? Kapha will not move
Yeah,
because kapha is solid.
yeah,
If you give the moksha, then kapha will start to melting.
yeah, yeah.
So for the kapha disease, moksha is very good.
But bloating with the excess air, you know,
It's not a good idea.
vata, so electrodes will move
Electro will
the
help
air
to move
more.
that air.
They'll help,
Yeah. So when you are doing like this,
yeah.
it's giving you more contractions and relaxations in your relaxed body. So that will help you to move that congested gas.
Okay.
Understand?
Yeah.
Electro we already discussed like very deep.
I know,
subject.
I know. But as well, I see from like Vata's cold, you know, as well. So maybe you need some heat to heat it up, you know.
Yeah, so in these conditions, what we do, if you remember, we said one day you can give diamine, and one day we'll give GT. GT
Okay.
help to melt that overall stagnated kapha. Okay, but the best thing, go with your tongue diagnosis.
Okay.
Because when gas is more congested, no? And
Yeah.
gas is more cold, whenever gas is congested, especially nitrogen gas in our stomach, it becomes the cold. In that condition, what will happen? All your missing mucus layer become the cold. They become frozen. In that condition, your tongue become white.
Okay.
When will come on the kapha, no? I show you this tongue. When will come on the kapha? So the kapha congestion, most of time is happen through your
I would have just thought, you know, Vata's.
see, this. You see this white coated tongue?
Yeah.
This all is mucus congested.
Yeah.
Okay? In this
Yeah.
type of the tongue, okay, this is yellow. See this
This
one.
right.
Okay? In this type of the tongue, mostly we suggest to give them more moksha.
Yeah. To melt. It's but like, you know, with bloating, it's excess Vata or whatever, excess air. If you give the electrode, you're saying to move it. But like I would have thought Vata is excess movement anyway, so you shouldn't apply the electrodes because it's more movement.
Sorry, please again.
Vata is like excess movement. Bloating is air, like trapped. And if you're giving the electrodes, it's more movement again. So Vata, it's already excess Vata, and then you're giving electrodes, and then it's excess.
Yeah, the one small doubts. If you remember, I said if there is a cracked tongue, then we
Yeah.
will not give the electrode.
Okay.
Yes.
If you remember, if there is a cracked tongue, then what I said, there is already excess movement of the gas. So we will not give
Electrodes.
electro. If there is a contraction,
You
Then-
give electrodes because there's congestion.
right? Cracked tongue, I already told you, no, superficially needle and just needle. If there is a cracked tongue, then just insert the superficially needle and just needle. Don't give the moksha, don't give the electro. If there is a contracted tongue, then you can give the electro. Okay? The white coated will give mostly yellow coated also. When you come yellow coated, there is also some specific point. On that point, we can give the moksha.
So a cracked tongue doesn't mean that the person has constipation.
Sometimes have constipations. There is
And
more dryness.
definitely needs excess air, excess Vata.
Excess movement of the vata.
Yeah.
Okay, there is two types of the vata. One crack, which is the excess movement of the vata. Second, when this is contracted tongue, means the vata is congested. In congested vata, when we will give the electro, then the vata will get more vibration and the vata will start to move.
It's just I associate congestion with kapha, not with Vata, because Vata is movement.
Congested with
You think congested is just kapha. Like when you hear the word
there is
congestion,
vata,
you-
there is vata
Vata
congestion also.
congestion.
So the contracted tongue is vata congestion, no?
yeah.
The contracted tongue is starting first with what we learned, the correct tongue and contracted tongue. Correct tongue means the excess movement of the vata, and contracted tongue means the vata is congested.
Yeah.
Understand? When we come on the like here, coated tongue. Okay, coated white, coated yellow. Coated yellow means there is more humidity congested, and coated white there is more mucus congested.
Yeah, it just means that Vata isn't always excess movement.
Yeah, but there is most of time congestion also. No?
Mm.
When we show this tongue, we are going reverse.
Yes.
Yeah, I just associate it with.
As you know, I can feel, I was looking for another.
Just a minute. What is this tongue?
The lung,
The lung is contracted.
yeah.
When lung is contracted, what we discuss?
When it's contracted.
Yeah. So okay, this is simple. Where is the congestion? This contracted
On the heart.
on the heart.
Yeah.
Contracted organ. What we discuss, organ itself become the shrink.
Dry.
Okay, there is not enough circulations. Okay, the contraction means the gas contraction only. If there is like white coated tongue, then there is a kapha congested. Okay, if there is a black one, then there is the
Pitta.
Yeah.
pitta congested.
Yeah.
So three of that can congested. Okay.
It's not an excess vata, so it's more like a depletion of
See-
vata. Like, do you know the way in
Yes, it is
Chinese
depletion.
medicine
You
you
can-
have
yeah,
dial
you-
up, dial down?
Yeah, you can mention about deficiency because if vata is not moving, that is deficiency only.
Yes.
Yeah.
If vata is not moving, that is deficiency only. If there is crack, then it is excess of the vata.
Okay.
Okay?
Sir, in Diamond we use electrode
Yeah, we use electrodynamic.
every time, no problem.
You can use it every time, no problem.
But if the person is so skinny.
So skinny, then no electrode.
Yeah, because remember it was a Spanish lady yesterday?
No, from France.
You only do
Oh,
REN
it was
10 and
French.
12 if they're so
Because she
skinny.
was having
You can
constipation.
give it. Otherwise, for a tummy,
Skinny.
for him, we not give electrode.
Excess vata
Where you will give electrode?
for her.
If you are doing muscular treatment, you can give electrode.
Mm.
You need electrode? Yeah. हाँ देंगे भाई।
हाँ, जगह वो।
इलेक्ट्रो के साथ ही देंगे अगर पेशेंट थोड़ा सा फैटी है, if patient is skinny, we'll avoid electro. Done? Okay. Now we'll go. Okay. Before that, we'll start little bit protocol for the pitta migraine. Okay. Mostly Diamine will help to reduce migraine. If there is a what you will see on the tongue, just target that. Okay. For example, some patient is came to you having the migraine. So first you will not do any other protocol. What you will do first? What is symptoms? What is the like diagnosis on the tongue?
Yellow.
If there is related to liver, go with liver protocol. If related with your heart, go with your heart protocol. That is the as per tongue diagnosis fixed protocol.
Okay.
What you see on the tongue, that is a fixed protocol. Second, we do the symptomatic protocol. Okay. Second, we do symptomatic protocol. That protocol will help a lot to reduce the migraine immediately. Is anyone having the headache issues or migraine issues?
Ajaya.
Or this is very good for mental tension also, not for just migraine and headache. This treatment is very good for mental tensions too.
I have mental tension, I think.
Or what?
I said I have mental tension.
Okay, it's good for you.
I
have
don't
mental
want
tension.
Would you do it for me?
Come and sit in front of everyone.
Isabella, yes.
Everyone here. Just reduce tension a lot. See, mental tension with everyone.
She's like, okay, I'm getting some nice food treatment.
Come. There is some notification on your laptop. Okay.
For a minute, I thought she did lotus pose.
So first two needles we use for the temporal area. Okay. There are small lots of the arteries. Many arteries. If you see the temporal area, no? There are many small arteries. If you go more deep, then you will feel there is one bump. The blood will stagnate. Okay. So what we'll do? Just end of your hairline, half tune back side. We'll go like here, only this much, very superficially. The best thing to give the more proper stimulation. Okay,
Both sides.
both sides.
So migraine
Very
headache
superficial.
is always temporal headache. I don't
No,
know.
no. It's just
asking.
that pitta.
This is a pitta headache.
Oh,
If the kapha headache, then here. Okay, vata headache mostly here. Mostly migraine is connected with the pitta and kapha. Vata will give you headache but not the migraine. Second, we use the one more point for temporal, the above the your ear here. This is a good point for endocrine. Also, we use for diabetes protocol. When we come on diabetes, we use this protocol. This temporal is okay.
both sides.
Both side here.
Oh, just above the ear.
ಕಿವಿಯಿಂದ ಎಷ್ಟು ದೂರ
Just from above the, this is not like acupuncture point. This is the one muscles called the temporal muscles. Okay, this here till this big.
So you're just touching the muscle.
Yeah.
first,
Okay, but
stimulate.
always remember this needle will be very superficially.
Just
Okay?
the top.
Is it hard or soft?
Hmm?
Is it hard or soft?
What?
The
This one? This
Yeah.
one you can touch to the bone.
Yeah, because yes, last night I did the crown for him, you know, because he had a headache, and I did half a tune from the center point. It was so hard. He wanted me. I know it's supposed to be one tune, but I did half a tune, and it was so tough to get the needle in.
I'll try to do. Have you checked below the here? There is no plate, right? Iron plate or anything. Okay, these 2 points. With this, you can use like PC6, ST7. That is good for mental tension, not for migraine. Okay, migraine we use mostly this protocol only. Sometime if you see that there is contracted tongue, you can use the GB. Okay,
20.
yeah, and if there is a tip of the tongue is black, okay, then what we are using the black tongue the protocol we use that. But after that you can use the ST9 heart 9 is very good to reduce the tensions. Okay, with this sometime if you want you can use yin tang is very good to relax the body.
Shit, that's me.
Except if they're on steroids, is it? You don't use yin tang. If they're on steroids or antibiotics, you don't use yin tang.
How did question is come?
Huh?
Honest reply.
What?
Why you ask the questions?
Because
Yesterday question.
yeah,
Okay, what I said, when there is, they just took the steroid. For example, yesterday one patient came, she took steroid in the eyes. Yesterday one patient came, she took the steroid in the eyes. If immediately we are using needle on that area, okay, then steroid will come toward of the needle more, because steroid in your collagens and in your fascia. And when you insert the needle, fascia will contract, the more steroid will come in the needle.
she told me she finished steroids 5 weeks ago. How long do you have to wait?
5 weeks or 5 days? No.
5 weeks, she told me anyway.
No, not 5 days. 3 days before. She told me 2-3 days before.
She told me 5 weeks.
No, maybe misunderstanding. Maybe I had misunderstanding or you had misunderstanding.
But how long should you wait anyway is my question. Like, you should wait
I think 3 weeks enough.
2-3 weeks.
Okay? 2-3 weeks is very enough. So, this see.
It's complete.
Yeah. This treatment is help a lot to reduce migraine immediately.
Oh, okay.
Okay, this needles will reduce migraine immediately. For example, someone is coming for the migraine.